ventilation with advanced airway, compress at a rate of at least 100 compressions per minute without pauses for breaths. Give 1 breath every 6 to 8 seconds, or 8 to 10 breaths per minute. You've learned a lot so far. But another thing you should know is what to do if a victim has a pulse but is not breathing effectively. When an adult, child, or infant has a pulse but is not breathing effectively, rescuers should give breaths without chest compressions. This is rescue breathing. For adults, give 1 breath every 5 to 6 seconds, about 10 to 12 breaths per minute. For infants and children, give 1 breath every 3 to 5 seconds, about 12 to 20 breaths per minute. Give each breath in 1 second. Each breath should result in visible chest rise. And you should check the pulse about every 2 minutes.
Whenever you suspect a head, neck, or spine injury, if possible, use a jaw thrust instead of a head tilt chin lift. This opens the airway while minimizing movement of the head and neck. Place your fingers on the angles of the jaw and lift the jaw forward. This will move the tongue away from the back of the throat and open the airway. If you use a jaw thrust to open an airway on a victim with a suspected head, neck, or spine injury, and your breaths are ineffective, use a head tilt chin lift to open the airway. In some victims, you may see occasional gasps. If the victim is not breathing adequately and is gasping, give them 2 rescue breaths. If a victim remains unresponsive but starts to breathe adequately and has a pulse, you should move the victim into the recovery position. Do this by placing the victim on his or her side, supporting his or her head and neck while doing so. This should only be done if you don't suspect a head, neck, or spine injury.
Chain of survival provides a useful metaphor for elements of the ECC systems concept. The 5 links in the adult chain of survival are immediate recognition of cardiac arrest and activation of the emergency response system, early CPR with an emphasis on chest compressions, rapid defibrillation, effective advanced life support, and integrated post-cardiac arrest care. The 5 links in the pediatric chain of survival are prevention of arrest, early high-quality bystander CPR, rapid activation of the EMS or other emergency response system, effective advanced life support, and integrated post-cardiac arrest care. But the most important link in the chain of survival is you.